Imagine looking in the mirror and seeing a stranger staring back at you. One eye is bright, sharp, and full of life, reacting to the light, but the other, it is cloudy, angry, and dark. It is not just blind, it is broken. Deep inside that eye, hidden behind the milky surface, a silent danger is growing. It might be a tumor, a painful pressure that never goes away, or an infection that threatens to spread to the brain. The connection to the world has been severed, and the signal is lost. Today, we are going to fix that. We are going to take a journey from darkness back to light, witnessing one of the most emotional and precise surgeries in modern medicine, the complete replacement of a damaged eye. It begins with a difficult choice, but a necessary one. To save the patient's health and restore their confidence, the damaged organ must go. But this is not just about removal, it is about reconstruction. The surgeon prepares the field with absolute care. We are not just taking something out, we are preparing the ground for a masterpiece of illusion. Watch closely as we start. We gently hold the eyelids open and focus on the white surface. The first step is delicate. We carefully peel back the clear outer layer, the conjunctiva, like lifting a fine silk sheet. We need to reach the engine room underneath, the muscles. Your eye moves because of four main muscles that pull it left, right, up, and down. These muscles are precious. We cannot lose them. The surgeon hooks them one by one, sliding a smooth tool underneath. We tag them with purple threads, securing them like safety lines. We are detaching them from the damaged eyeball, but we are holding onto them tight. They have a new job to do soon. Now comes the turning point. We reach deep behind the eye, into the shadows of the socket. We locate the optic nerve, the cable that once carried vision to the brain. That line has been silent for a long time. We clamp it to prevent bleeding, and with one decisive, respectful action, the damaged eye is removed. The socket is empty, but we do not leave it that way. Enter the miracle of bioengineering. This white sphere you see is not just a plastic ball. It is a porous implant made of a material that looks like microscopic coral reef. It is full of tiny holes. We place the sphere deep into the socket to replace the lost volume. It fits perfectly. Now remember those muscles we saved. This is where the magic happens. We pull those muscles forward and stitch them directly onto this new sphere. We are rigging the system. When the patient tries to look left, their brain sends a signal to the muscle pulls the sphere, and the implant moves. We are rebuilding the natural movement. We cover the implant with the patient's own tissue, stitching it closed layer by layer. The white sphere is buried, hidden safely inside a pink, healthy pocket. The surgery is done, but the body's work is just beginning. Over the next few weeks, the body wakes up to this new guest. Tiny blood vessels grow out of the tissues and travel as into the microscopic holes of the sphere. The implant actually becomes part of the patient's body, a living, moving core. While the healing happens, an artist takes over. An ocularist, a painter of eyes, sits in a quiet studio. They look at the patient's healthy eye, the hazel flecks, the depth of the pupil, the tiny red veins in the corner. They hand paint a custom acrylic shell to match it perfectly. It is hyper-realistic, a twin to the living eye. Finally, the moment of truth. The swelling is gone, the socket is healthy and pink. We take the custom painted shell and gently slide it under the eyelids. It snaps into place over the living implant. The patient blinks. They look up. They look down. The artificial eye moves in perfect sync with the real one. The cloudiness is gone. The pain is a distant memory. When they walk out into the sunlight, no one looks away. They see a whole person. From a dark diagnosis to a bright future, this is the art of restoration.